Aplastic anemia is most commonly acquired rather than inherited, and toxic exposure is the single most frequent trigger. However, it can also arise without any identifiable cause, a presentation referred to as idiopathic aplastic anemia. A critically important immunological mechanism underlies many of these idiopathic cases. Autoreactive cytotoxic T cells misdirect their killing machinery against the body's own hematopoietic stem cells, treating them as if they were foreign or dangerous targets. These T cells are not simply overactive in a general sense. They are specifically dysfunctional, attacking the very cells responsible for generating all blood cell types. This autoimmune mechanism carries direct therapeutic implications. It explains why immunosuppressive strategies can be highly effective in patients who are not candidates for bone marrow transplantation. Therapies such as anti-thymocyte globulin and cyclosporin work by suppressing T cell activity and interrupting this misdirected immune attack at its source. This is the cornerstone of non-transplant management in aplastic anemia, targeting the underlying immune dysfunction rather than simply attempting to replace the damaged marrow. Among the external agents known to trigger aplastic anemia, ionizing radiation is one of the most well-established. It works by directly damaging DNA and obliterating the rapidly dividing cells of the bone marrow. A marrow is among the most sensitive tissues in the entire body to radiation injury, precisely because it is so metabolically active and constantly undergoing cell division. That constant activity, which is normally its strength, becomes its vulnerability when radiation is involved. On the chemical side, benzene is the prototypical culprit. It is an organic solvent found in many industrial products, making occupational benzene exposure a recognized and preventable risk. Related organic compounds carry similar potential for marrow toxicity. The mechanism involves benzene's toxic metabolites interfering with stem cell function and DNA integrity at a fundamental level. The key clinical takeaway here is that any significant benzene or related organic compound exposure should be actively explored when evaluating a new case of aplastic anemia, particularly in patients with relevant occupational or environmental exposure histories. This is not a detail to overlook during history taking.